Hi everyone, welcome to my YouTube channel. We are back with another video. Here we are again. Today we are going to look at something different. We are diving into mental health and psychiatric nursing, where we're going to pick something very short from a certain topic, and that topic is epilepsy. That's our topic of today. Nevertheless, don't forget to subscribe and also hit that notification bell to ensure that the next time I upload a video, you'll be notified and then you'll be able to learn from that video. To begin with, we're going to look at stages of epilepsy. That is our topic of discussion today. We're going to look at stages of epilepsy. We're not going to go much into, there are types of epilepsy, how to manage a patient with epilepsy, there are types of seizures. We also look at predisposing factors. All those things, we can talk about them on a different day using a different video. But as in for now, we're looking at the stages that are found in epilepsy. There can be stages or phases, however way you're going to put it, we're actually talking about the same thing. So to begin with, we need to define what epilepsy is, and then we're going to go to the stages in case you don't know what this condition is all about. So we're saying epilepsy, this is just a neurological condition which affects the central nervous system, in which there is an abnormal discharge of electrical impulses from the cerebral cortex. And then we find that this patient will actually manifest with violent jerking. They may be floating from their mouth, eyes can be rolling upward. All those things are a few characteristics that a patient with epilepsy may manifest. So I hope you got the definition. So we find that there are a few things that are altered in the brain, and then this patient begin to have this manifestation whereby there will be an abnormal discharge of electrical impulses. These electrical impulses, they do control our body, how we walk, we talk, we do things. It's the duty of these electrical impulses. So when they are disturbed, we find that there is that disturbance in the muscles, in the nerves, and then we find that the patient will begin to start jerking, all those things. So that is what the condition is all about. And then coming to the stages of epilepsy, we are looking at the stages of a generalized seizure or of a grand mal seizure. So looking at these stages, we've got 4 stages, but if you want, you can put them 5, because in mental health, we usually add prodromal phase, then the second one, which is aura, third one, which is tonic, the fourth one, which is clonic, and then the last one, which is coma. You can still use some other terms such as pre-ictal, ictal, post-ictal, inter-ictal, all those. You just pick the one you're comfortable with. But today we are going with the aura part. We're not getting the pre-ictal, ictal, and post-ictal phases. However, they mean the same. It's just the difference in the headings. So now to begin with, we are saying the first stage that is involved in epilepsy, it's a prodromal phase. So this phase, when you are writing under, let me say maybe NMCZ brings this question, or maybe end of year or during your mock examination, you need to write prodromal phase. You underline it. After underlining, you're going to describe what this phase is all about. Moreover, we are just going to outline the characteristics that are found in that stage. So looking at prodromal phase, we are saying this is the first stage in the development of epilepsy. We find that under here, a patient may manifest with few signs and symptoms such as irritability, headache, insomnia. So it usually occurs 2 to 3 days before the actual seizure. So that is prodromal phase. And you find that maybe a patient may also feel nauseated, they may feel like they want to vomit, all those things. They'll be ill-tempered, there'll be that anger. So those are a few signs and symptoms that we find in prodromal phase. And then coming to the second one, we are saying in the second stage, we are saying it's aura stage. However, you can start from aura. They'll still mark you. Maybe they'll say 4 stages of epilepsy. You can still start from aura if you don't want to add prodromal, but prodromal is also part of it. So under aura stage, we are saying this is a second stage or first stage in the development of epilepsy, and it takes actually 2 to 6 minutes. So we find that as a patient wants to start a seizure, we find that they'll begin to feel some disturbances in their senses, such as they'll see a flash of light, they may feel a certain smell, a different smell, they may hear an awkward sound, maybe a different taste in their mouth. So you find that those are few things that are found under aura stage. So looking at this stage, it doesn't take place within let me say it takes place within a short period of time, in the sense that we find that it doesn't give a patient enough time to prepare for the seizure, because it's just 2 to 6 minutes, and then a patient goes into tonic stage. So what I've said, you need to talk of the time. This only takes place from 2 to 6 minutes, and the signs and symptoms that I had outlined, those getting a different smell, a flash of light, different taste, awkward sound, all those things, you need to add them as you're writing aura stage. And then after the patient feels those things, they go into the next stage, which is tonic stage. So under tonic stage, we find that maybe the patient was standing, they now go into unconscious state. When they go into the unconscious state, we find the patient will fall down to the ground. Once they fall down to the ground, the body becomes stiff, it becomes rigid, it doesn't move, there is no jerking, it will be just stiff. After that, we find that the jaw may be locked. If sometimes the patient may even hurt themselves because they are locking their jaw unconsciously, and you find that they may end up biting their tongue at this stage. And then from there, we find that there is also breathing can also cease due to that body stiffness, and a patient will also have that epileptic cry due to the closed epiglottis. And then another sign that a patient manifests with under this stage, a patient will also have, a pupil may dilate, eyes may be rolling, all those things are a few signs. So under tonic stage, you're just talking about the rigidity of the body, the locking of the jaw, the ceasing of the breathing, and the patient may also become cyanosed if this stage prolongs, though it only takes about 20 to 30 seconds. And then someone goes into another stage, which is a clonic stage. So in clonic stage, after the patient has become stiff, the body is rigid, they go into clonic stage where they manifest with jerking, violent jerking. This is where the actual manifestation of epilepsy is. A patient will begin to jerk, and then they also may be frothing from their mouth. There'll be those let me say, how can I call it, there'll be more like some saliva coming out with some sort of bubbles, or those things, that is frothing. And then they may also manifest with another sign, which is there can be fecal and urinary incontinence due to relaxation of the sphincter muscles. So that is another sign which is found under clonic stage. And we also say that breathing is re-established in here. We find that the patient will be breathing well, though they'll be jerking, eyes will be rolling upwards. So as a nurse, you need to ensure that at this stage the patient is actually in a safe environment, because they may end up hurting themselves as they are jerking, because the body will be just throwing itself here and there involuntarily. So that is what is found in clonic stage. And then coming to the last stage, which is coma stage. From here, after the patient is done with the jerking, you find that they'll go into deep unconscious state. They'll go into a deep sleep, whereby maybe it will take a few minutes and then they'll come back to conscious state. But after that, if you were to ask them immediately after they come back to conscious state to say what was happening, one thing we find in common amongst this patient is that they want to realize what was happening. Even if you ask them what was going on, did you feel yourself the time you fell down, they won't remember anything. So those are a few things in coma stage. After someone gets out of the deep sleep, they usually wake up with that confused state a bit, but after some time, after orientation and giving them a bit of time to relax, you find that these patients, they actually get back to their normal state. So those are the stages of epilepsy. You can put them 4 or 5, however way you want them. You're still good to go if you can write all of them. So thank you so much for your attention. If you've got any question, don't forget to ask in the comment section, and also don't forget to just share the video. You can still download it and listen to it some other time if you're busy right now. So those are the 4 stages of epilepsy. And when the seizure prolongs, when it goes to about 30 minutes after giving treatment, the patient doesn't respond, we call that as status epilepticus. So that is that for today. We end here. Thank you so much for your attention.